Hi there, my name's Kyle Morrison. I'm a student with Valdosta's F&P program. This is my wife, Carly. Carly, do you give consent to be part of this abdominal exam?
I do.
Okay, so what we're going to start off with is first, since we're going to kind of expose Carly here, we're going to do a skin assessment. So Carly, if you would, go ahead and lay back. And let's see the abdomen. Okay. So just looking at the general appearance of her skin, there's no definitive scarring. Go ahead and pronate there you go. No scarring, no signs of clubbing, cyanosis anywhere. Temperature, it's nice and warm. Texture, nice and smooth. And also, while we're here, we can check out the skin turgor for hydration status. So we're just going to take a little piece of skin, pinch it, and then release and see if it goes straight back to normal, and it did. So hydration status is good. And now we'll begin the actual assessment of the abdomen. So first off, we're going to inspect the abdomen. Looking at the abdomen, we're looking for, first of all, symmetry, which as you can see here is very symmetric. There's no obvious signs of any kind of masses, no obvious signs of fluid or ascites, no jaundice of the skin. There's no scarring to represent any kind of past ileostomies, coleostomies. Let's see, so then after inspection we're going to do auscultation. We kind of break up the pattern to make sure we don't disturb any kind of bowel sounds that would happen if we were to do palpation or percussion. So first, let's listen to all four quadrants. Got the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Listen to all of those for bowel sounds. Let's give a listen. Okay, so the bowel sounds are normal active. Next, we're going to auscultate for the arteries of the abdomen. So we have, as a precursor, we have regions of the abdomen, more so than the quadrants. So first, we have between the umbilicus and the xiphoid process, we have the epigastric region. Then to the, on the right side, we have the right hypochondrium. Then on the left side, we have the left hypochondrium. Then we have the right flank, the umbilical region, the left flank, and then down below in these regions, we have the right iliac fossa, we have the suprapubic region, and then we have the left iliac fossa. So what we're going to do is listen for the abdominal aorta, which is in between the umbilicus and the epigastric region. Then we're going to listen to the renal arteries, which is going to be bilateral. The hypochondrium regions, and then we're going to listen to the iliac, which of course is going to be in the iliac fossa regions. So let's listen for any kind of bruits. So aorta and renal arteries, there's nothing present, no bruise. And then lastly, the iliac arteries. No bruise present. Okay. So now that we've auscultated the abdomen, now we can begin the percussion and palpation. So first, we're going to do some percussion of the liver to find the liver span. Now there's a couple tests to find the liver span. First of all, the clinically most sound way is, of course, doing a liver ultrasound. But just kind of on the fly, we can do, first of all, what's called a scratch test. This is usually the most enjoyable test for patients. So let's go ahead and let's see what that's like. So I'm going to simply scratch along the right lower quadrant going cranially upwards. And what you'll notice is kind of a resonant, low frequency rub. And then as you hit the bottom liver span, you'll hear a more intensified sound. And as you keep moving up, that intensity will eventually drop off, and that's where you know you've reached the upper limit of the liver. So let's go ahead and we'll place the stethoscope right below the xiphoid process and see if we can figure out the liver span. Okay. All right. Find the xiphoid process. Now, the liver should be located right beneath the right costal margin. So I'm going to start below that and scratch. Right there. You can hear the intensity. And it's dropped off. So that drop off means we've gone back to lung space. So the next step, good job by the way, the next step we can do is by percussion. So to percuss the abdomen, we're going to first start off in the right lower quadrant here. And right there we hear resonance. We're looking for dullness of the liver. There we go. So we know to draw a line here. Okay, sorry. Okay. Okay. Still dull. And then resonance should be right up here. There we go. So actually the percussion of the liver and auscultation of the liver with the scratch test ended up being a similar liver span of approximately 8 centimeters, which normal is 6 to 12 centimeters. Now we're just going to continue with the percussion. Okay, we're going to percuss in all 4 quadrants just to notice if there's any kind of abnormalities, such as maybe urinary retention, any kind of, we should hear a gastric bubble, any kind of splenomegaly, and any kind of maybe bowel blockages. So let's go ahead and percuss. Good. that takes care of that. Now we're going to do some light palpation. Okay. Now, are you in pain anywhere in your abdomen? No. Okay. So I'm just going to lightly palpate in all 9 regions. And this light palpation is just kind of a precursor to deep palpation, just to find if there's any kind of obvious masses or any kind of pain that we should be aware of before we do deep palpation. So now we can move on to deep palpation. So with deep palpation, before doing the 9 regions, I like to go ahead and start off with assessing for, first of all, hepatomegaly and splenic hypertrophy. So what I'm going to do is just tell the patient to take deep breaths while I press in deeply at the, we start at the right lower quadrant. Okay, nothing palpable, so you just move a couple centimeters up. And really the liver should palpate your fingers, not the other way around. There. So I'm able to palpate her liver, which it needs to be described in characteristics such as hard, soft, if it's tender, and if it's smooth and regular, which in this case it's smooth, regular, soft. Then we're going to do a similar assessment of the spleen, which you start off from the right lower quadrant and you work your way over, okay, to the left upper quadrant. And the spleen should not be palpable unless it's about 3 times its normal size. Okay, so just keep taking deep breaths. Good. Good. Okay, no pain. Okay, so the spleen wasn't palpable. Now we can go ahead and begin the 9 regions. And just breathe normal. Just feel your belly. No kind of hernia history. Alright, so we've touched on the 9 regions there with light and deep palpation. See, that's everything. Okay? Any questions about the assessment? No. No? Okay. Well, that's all for the assessment of the abdomen and the skin. And that's it. We'll see you later.